We all know that month of October, it's a mental health awareness. So it's our day 3 under our slogan, our mental health matters. So colleagues, my name is Sibonelo Kumete. I'm going to be the program director for today. I am based in Pietermaritzburg. Uh, Without wasting time, colleagues, let me call Miss Rolyn Steto, who's going to introduce our speaker for today.
My name is Rolene Steto. I'm a student mentor from the KZN region, and I'd like to please introduce Dr. or Miss Bongi Thusi, who is a registered educational psychologist with the HPCSA. She's a former teacher and former school counselor. She's a Unisa alumni and previously worked in Unisa and UKZN as a student counselor. Currently, she is working in the Department of Education in Umgungundlovu district. Part of her duties include the facilitation of the learning program for learners with severe and profound intellectual disabilities in special schools and special care centers. She conducts psychological assessments, psychotherapy, and psychoeducation in the schools and works with both parents, caregivers, and teachers in ensuring that learners with intellectual disabilities are given support and care. Bongi manages a multidisciplinary team consisting of speech therapists, occupational therapists, physiotherapists, and senior teachers. She works on a part-time basis with learners experiencing barriers to learning development delays, autism spectrum disorder, ADHD, and those with emotional or behavioral issues. She subscribes to the notion there are no limits on what you can achieve with your life, except the limits you accept in your mind. Please welcome Ms. Bongi Thusi.
Thank you so much for the invitation from Unisa, Student Counseling Unit. Thank you so much for the invitation. I feel so humbled and honored that I was invited to present on this very important topic on ADHD in adults. Good morning, colleagues. Good morning, Unisa staff. Good morning, students, and good morning also to our student mentors. Thank you so much for attending this session. As you know, the topic for this session is ADHD, or Attention Deficit Hyperactivity Disorder in adults. And the presentation, I've got an outline for the presentation. Firstly, we are going to define Attention Deficit Hyperactivity Disorder, because I believe that some of us don't know exactly what it is. So it's very important for us that we define it. And we are also going to outline the symptoms and the types of ADHD. Then we are going to proceed and we are going to look at what happens in the brain when a person is having or is diagnosed as having ADHD. Then we are also going to look at the development and the cause of ADHD. We look at the risk factors. We also look at the prevalence of ADHD. Then we'll look at comorbidity, the treatment and coping with ADHD. Then we are going to conclude. And there's also going to be time for questions. Thank you. Proceed to the next slide, please. Number 2. Okay, so exactly what is attention deficit disorder? It's a persistent pattern of inattention and hyperactivity or impulsivity that interferes with functioning or development. It's characterized by, firstly, inattention, and secondly, hyperactivity and impulsivity. It's very important for me to define what inattention is so that all of us have a basic understanding or a common understanding of what it is. Inattention can be loosely defined as the lack of focus or concentration. And hyperactivity can be described as excessive motor activity. For example, you can see it in children, for example, when they're running, when they're jumping, when they're climbing, when they have the inability to sit still or they have difficulty in sitting still. So that is some examples of hyperactivity. Impulsivity, it refers to hasty actions that occur in the moment without forethought, that have high potential for harm to the individual. So it's when you make decisions without giving it much thought. Impulsivity may reflect a desire for immediate gratification or rewards, and it may also manifest as social intrusiveness or as making important decisions without consideration of long-term consequences. Next slide, please. Okay, we did say at the beginning that a person needs to be diagnosed as having ADHD or Attention Deficit Hyperactivity Disorder. But what are the symptoms that are required for a person to be diagnosed as having ADHD? According to the DSM-5, which is the manual that we use for diagnosis as psychologists and psychiatrists, there need to be 6 or more of the symptoms that I'm going to list that have persisted for at least 6 months, and they negatively affect directly on social and academic occupational activities. So there needs to be 6 symptoms that can be seen in a child, but for an adult, at least 5 symptoms are required for a diagnosis of having inattentive symptoms. The first symptom is when you make careless mistakes. When you are, for instance, completing your schoolwork, when you are at work, or during other activities. So you are likely to make careless mistakes, and you also fail to give close attention to details. Another symptom for inattention is when you have difficulty sustaining attention in tasks. So the tasks that require you to remain focused, for example, during tutorials or even in exams, you have difficulty with those activities or tasks. Also, you often do not seem to listen when spoken to. So this may be seen as daydreaming or zoning out. So when people speak to you, you appear as if you are not listening, and people may say to you that you are daydreaming. And also, you often have difficulty following through on instructions, and you fail to finish your schoolwork or your duties in the workplace. A person with inattention also has difficulty organizing tasks or activities. This may be seen as poor time management. This may also be seen in disorganized work, and the person is usually messy. And a person with inattentive symptoms also often avoids or dislikes or is reluctant to engage in tasks that require sustained mental effort. Then you may also lose things necessary for the task. For example, school materials, you lose your pens, your pencils, you lose your books, you lose your keys, your mobile phone even. And if you are inattentive, you also often easily distracted by external stimuli. In adults, these may include internal unrelated thoughts. So we are still going to say more about that. And a person with inattention is often forgetful in daily activities. So most of the time, because you are not paying attention, you are going to be forgetful. Even when people are telling you instructions or you are learning in class, you are going to be forgetful because you are not being attentive. Okay, can we move on to the next slide, please? Okay, the next slide is about hyperactivity and impulsive symptoms. These are required also for you to be diagnosed as having ADHD. For this criteria, 6 symptoms need to be present for at least 6 months, and these symptoms need to interfere with social and academic or occupational activities. Okay, so these symptoms are often seen with fidgeting or squirming. So you may fidget with your hands or with your feet, and you may squirm in seat. So in other words, you are unable to sit still. So instead of you sitting still, you fidget and you squirm. In some children, you even notice that they shuffle their feet under the table when you are doing assessments, for instance. And the person with hyperactivity and impulsivity symptoms may often sit in situations where remaining seated is expected. And a child particularly may run around or may climb in situations where it is inappropriate. In adults, this may be limited to restlessness and fidgetiness. So in adults, we don't see the running around or the climbing, but instead we see the restlessness and the fidgetiness. A person with hyperactivity and impulsivity symptoms also is often unable to engage in leisure activities quietly and is seen as often on the go, acts as if he's driven by a motor. So he becomes uncomfortable when sitting still for extended periods of time. So he's often on the go. He's energetic. He doesn't want to be still. And also, the person often talks excessively. So the person can't keep quiet. There is this need that you need to talk excessively. And you may see it also when a person blurts out answers before questions have been completed. So this is a sign of impulsivity, that you can't wait for your turn in conversation, you just blurt out your answers. Even in the classroom, a child, you may see the child raising up the hand before the complete question has been asked. Also, the person who is having this hyperactivity and impulsivity symptoms often has difficulty waiting his or her turn. For example, while waiting in line. So they are unable to wait for their turn. And children, when they're playing in the playground, for instance, when they're playing games, you find them unable to wait their turn. And impulsivity may also be seen when a person often interrupts or intrudes on others. You may intrude into or take over what others are doing. And this may be very disruptive in class when the child interrupts or intrudes on other people. And also at the workplace, it may also become very disruptive when a worker interrupts or intrudes on other workers. So I've mentioned some of the criteria that needs to be met for a person to be diagnosed as having ADHD. But there are 4 additional criteria that I'm now going to share on the next slide, which are also required for diagnosis of ADHD. Okay, are we in the next slide? Number 6. Okay, so there are 4 additional criteria, like I've said, that need to be met. The first one on this slide is symptoms need to be present prior to the age of 12. So this is very important because ADHD is a neurodevelopmental disorder. So it happens during the developmental stage. So one of the criteria is that it needs to be present prior the age of 12. Okay, also symptoms need to be present in 2 or more settings. So you cannot be diagnosed as having ADHD if symptoms only occur in one setting. The symptoms need to occur in 2 or more settings because symptoms may differ depending on context within a given setting. So for example, if the person is at home, the symptoms for inattention may be minimal, may not be noticed because at home you don't need to be attentive. But when you're at school, that is where inattention can be seen. So it's very important that symptoms are present in 2 or more settings, symptoms of inattention, hyperactivity, and impulsivity. Also, sometimes the symptoms cannot be seen, for example, when a person is in a novel setting. or there is external stimulation, or is interacting in one-on-one situation. So that is why it's very important that we know as psychologists what happens in other settings, because a child might come to you to be assessed, and when the child is in front of you in the assessment room, you don't see any signs of inattention and hyperactivity and impulsivity, because the child is in a novel setting and also the child is in one-on-one situation. But with other children, it doesn't matter whether the child is in one-on-one situation or the child is in a novel setting. When the ADHD is severe, the child displays the symptoms everywhere, regardless of the setting. Also, another criteria that needs to be met is the clear evidence that symptoms interfere with or reduce the quality of social, academic, or occupational functioning. So the symptoms need to be, they need to interfere with your social, your academic, or your occupational functioning. So they need to have that negative impact on areas of functioning. And lastly, the symptoms do not occur exclusively during the course of schizophrenia or another psychotic disorder, and are not better explained by another mental disorder, for example, anxiety disorder. So the symptoms need to occur during an ADHD episode, if I may call it like that. So you cannot say when a person is having schizophrenia and is having inattention, for instance, then you diagnose the person as having ADHD. So ADHD needs to be seen even if there is no condition of schizophrenia or other psychotic disorder. But I am going to say also in the forthcoming slides that ADHD can be comorbid with other mental disorders, but we are going to get to this slide. So can we move on to the next slide, which is the types and severity levels of ADHD. Okay, there are 3 types of ADHD. The first one is predominantly inattentive presentation. So the therapist or the psychologist or the psychiatrist will look at the presentation of the symptoms that you present. If the symptoms that you are presenting are predominantly inattentive, then you are going to be diagnosed as having predominantly inattentive presentation. But the hyperactive impulsive criteria should not be met for the past 6 months. In other words, you are not going to be having hyperactive and impulsive symptoms. You are only going to have inattention symptoms if you have the predominantly inattentive presentation. If you have the predominantly hyperactive impulsive presentation, then it means that the symptoms that are going to be dominant are those which are inattentive, are those of inattentive symptoms. But hyperactive impulsive criteria are going to be met, but the person is going to have inattentive criteria that are not met for the past 6 months. There is also another type which is known as the combined presentation. That is when the person has both inattention and hyperactive impulsive criteria that are met for the past 6 months. So the word combined, it tells us that the person has inattentive presentation as well as hyperactive impulsive presentation combined. Then there are also 3 levels of severity. The first level is a mild one. So ADHD can be mild in other people. In other people, it can be moderate, and in other people, it can be severe. So for these severity levels, we look at the number of symptoms that are presented by the person and we also look at the functional impairment, how big the functional impairment is. So if there are few symptoms in excess of those required and there is minor functional impairment, then the person may be diagnosed as having mild ADHD. But if the person has many symptoms in excess resulting in marked impairment, then the person may be diagnosed as having severe ADHD. Then if the person has moderate levels of ADHD, it means the person is between mild and severe functional impairment as well as symptoms. So I've written at the bottom that note that the diagnosis needs to be made by a psychologist or a psychiatrist for a person to be diagnosed as having ADHD. But I'm aware that other health practitioners, also like GPs and pediatricians, may refer patients to psychologists and psychiatrists, sometimes to confirm diagnosis. So we work together as mental health practitioners and other health practitioners in order to diagnose a person as having ADHD. Okay. And I know that maybe to some of us, we do understand the symptoms, like I've mentioned some of the symptoms, but we don't understand the magnitude of ADHD. We don't understand, or we can't imagine the impact it can have on a person's life. And we also cannot imagine the far-reaching functional impairments it can have on a person's life. So I'm now going to ask us to watch a video which is about 7 minutes in length, and it's going to show us the impact ADHD can have on a person's life. Because some of us might think inattention is just a minor issue. May think it's a minor issue because for most of us, or for some of us, attention is automatic. But for people with ADHD, attention needs to be directed. They need to put effort in order to be attentive. So the video is going to show us the impact the inattention can have on a person with ADHD. The video is also going to look at impulsivity. For instance, it's going to look at the inability to regulate or constrain your actions, the inability to inhibit your actions, and it's also going to talk about hyperactivity and fidgetiness. For instance, it's going to look at the person who is going to be speaking to us in the video will tell us some of the symptoms that he had as a child that show that he was hyperactive or is fidgety now that he is an adult. So can you please watch the video? Bear with us, the video is about 7 minutes in length. Thank you.
To go to university, and it was around that age that I decided that I should try to get a diagnosis, and it turned out to be one of the biggest eye-openers of my life. I had always suspected that I was a little different from other people because of my experiences growing up and the fact that I did certain things that had me thinking ADHD could be a possibility. And of course, once I started education again, I realized that I was not able to keep up with reading and the learning and paying attention in class. So I started to really think, you know, maybe it's about time I went to get tested. And looking back on my whole life, when you go through the diagnosis, they walk you through childhood to present day, things really started to add up. The penny dropped. I just thought, yeah, it's so obvious. It's so obvious that I've got ADHD. So starting, believe it or not. I remember in school, I lost about at least 30 coats and jackets throughout the entire time there. And that's not even an exaggeration. I lost so many belongings, it's unbelievable. You know, I would frequently leave things behind, and I'd only realize after I'd left that, oh, I've left my bag behind. And that happened countless times. I was always a bit of an oddball as a child, and I was pretty unpopular. I didn't really fit in with other kids. I just didn't really understand social interaction as much. And I think that's obviously something to do with the late development of the ADHD brain, right? Because the brain matures later than other people. I always had a very strong imagination, like scarily vivid imagination. So I don't know whether that's ADHD related, but I certainly lived in my own bubble most of the time. I think the biggest sign is a telltale sign for ADHD in my childhood was the fact that I accidentally got into trouble a lot. And that's typically from zoning out and missing the instructions and not knowing what was going on. The amount of times the teacher would say something and I'd sort of not know what's going on, and then other kids would get mad at me because if we were doing a group work, I wouldn't be able to join in. I'd be like, what do we do? And so I'd look stupid then, and that obviously causes self-esteem to drop. Self-esteem was pretty bad as well. I always had very low self-esteem growing up, especially as a teenager in those delicate years. It's a hallmark trait of ADHD. It's this feeling of being fundamentally incompetent. And I was always daydreaming, staring out the window in class, zoning out. Now in my adolescence, these behaviours got worse. I had to have average grades, and in schoolwork I only really did well at the subjects that I had a real interest in. Everything else I just couldn't discipline myself to do the work. And it's still like that to this day. That's happening to me right now. Because I think the mind just doesn't get that sense of urgency. Nothing clicks. It doesn't sort of charge you up. It doesn't do anything for you. So therefore, it's pretty much impossible to feel engaged in it. And towards my late teens, I think that's when the testosterone starts kicking in. And in combination with ADHD, that's pretty bad. I went through a phase where I sort of would binge drink a lot and I'd make a fool of myself because I already had lower inhibitions because of the tendency to blurt things out. If you combine that with alcohol, it's a marriage made in hell. So moving on to adulthood, when I was in my early 20s, this was probably the most turbulent time of my life because I was just full of aggression and testosterone. And I had quite a short temper. I was very easily frustrated. And I was very emotionally immature. When I was younger, I lacked empathy. I was a lot more impulsive, and I just didn't really have much compassion. But the ironic thing, emotion and channel it into empathy. You can use that emotion and put yourself in other people's boots. I'd sort of interrupt people a lot, and I just, they'd be talking at me, and I'd be seething, I'd be bubbling up inside, and I just couldn't wait to get my opinion out. I couldn't wait to get my words across, and that's something I've learned to overcome. I remember I had a job as a cashier once, and I was so inattentive that I one time lost £100 in cash, and I still don't know what happened. How did I lose it? I don't even know. Just because my attention wasn't there. I would frequently get into trouble at work for being late, always late. Even though I knew full well ahead of time that I only had a certain amount of time to get to work, I still leave it to the last minute, or I just plan the morning routine poorly and I'd end up being late unintentionally. Either that, or it would be just making careless mistakes or being a bit too blunt towards bosses and colleagues. And oftentimes at work I'd put my foot in my mouth, I'd get angry, and I'd just be like a little boy inside. And my boss once told me, "You are falling apart." So what does that tell you? Honestly, I'm amazed I never lost jobs. And I think at one point in my mid-20s, I realized that I had an immaturity problem. I realized, right, now I've got to really take control of myself and man up. I've got to really practice self-awareness. So I actually went to get therapy. I went to get CBT, cognitive behavioral therapy. So I'm almost 30 years old now, and even to this day, I let things pile up. Typically, I have mugs all over the place. I'll go downstairs, decide I want to drink, and take another cup or glass up with me, and eventually it would all pile up on my desk or pile up on my bedside table, and it keeps happening to this day. I suck at managing money as well, so that's something I'm working on. Just things like impulse spending, it's something I've been notorious at. Just spend, even if I didn't have the money, just because it would give me a rush. In hindsight, I wish I had known this when I was a child, but I think back in the 1990s, people were sort of unaware of it, and people usually put it down to the child just being undisciplined. But it explains so much of my history that it was kind of like a eureka moment. I think overall, because I was never a hyperactive child, it was harder to diagnose it. So inattentive ADHD or ADD is obviously going to be less easy to spot. I remember there was one kid in my class who obviously had ADHD. He was just so hyperactive. He was throwing stuff around the class. He was shouting. He'd get up out of his chair. He'd defy the teachers and shout. I wasn't like that, you know. I was quite a shy kid. I was mostly a good boy, but my inattention just got me in trouble accidentally. But I've come a long way. I've come a long way, and I think I've done really well. I've changed a lot. I've practiced self-awareness, and my life's changed for the better. But obviously, there's still weaknesses there. That's it's just an innate part of my personality, and I think you can stay on top of it as long as you keep on practicing self-awareness and realizing that you have this condition that's affecting your mind and your behavior. So let me know in the comments below, when did you get diagnosed? Did you find out as an adult like I did, or was it something you found in childhood? If you enjoyed the video, give me a thumbs up.
Okay, thank you so much, Candice, for showing us the video. I'm certain that most of us now do have an idea of what it feels like having ADHD and how it can impact negatively on your daily functioning. In the video, the person who was speaking told us that he was diagnosed when he was an adult, but he had to look back and try to see some of the symptoms that he had when he was a child. What is fortunate for him is that he was able to be diagnosed and he was able to attend therapy and I guess medication as well. And he's saying that he's still struggling with the disorder, but he's on top of it. He knows now what disorder he has. Then when you don't know what disorder you have or what's happening with you, so he did mention some of the symptoms that I mentioned also in the presentation. For example, low inhibition, being forgetful and losing things, careless mistakes, letting out responses to his boss in the video, and also he got into trouble a lot at school, missed instructions. He was full of aggression sometimes. He was impulsive, and impulsive spending is also mentioned in the video, and vivid imagination is mentioned, and self-esteem is also mentioned. So I'm sure we can see what impact, the far-ranging impact that ADHD can have on a person who has been diagnosed as having ADHD. And I guess if you have not yet been diagnosed and if you have not yet received treatment, then it becomes very difficult for you because you see yourself as being different, but you don't know why you are being different. I think it's better when you know why you are acting the way that you do when you have been diagnosed, in other words. Thank you so much. Can we move on to the next slide, please, which is about risk factors. So what makes a person vulnerable to having ADHD? That is why we're looking at the risk factors or the prognostic factors. ADHD is associated with low birth weight. For some people who have been diagnosed as having ADHD, it doesn't mean that every child who has a low weight at birth is going to have ADHD. But sometimes it does occur that when a child has had low birth weight, that he also has ADHD. So these are the factors that make a person vulnerable. Another factor is environmental toxin exposure. For instance, when you have been exposed to lead as a child, or when the mother is pregnant and has been exposed to lead, then that can also be another risk factor. Infections also may be a risk factor. For example, when the young infant or the child or the fetus has an infection which is known as encephalitis, which affects the brain, or it's an infection that happens in the brain. Then also another risk factor is when the fetus is exposed to alcohol while the mother is pregnant. So alcohol exposure in utero can also be a risk factor. And also ADHD may be genetic, it may run in families. So it's very important for us to know some of the risk factors, especially I want to emphasize on the risk factor of alcohol exposure in utero, because some mothers do drink while they're pregnant and maybe they're not aware that they're exposing the child to some mental illnesses. Another mental illness or another illness that alcohol exposure in utero causes is one which is known as the fetal alcohol syndrome. So it's very important for us that we are aware of these factors that may cause ADHD or that may make the child be vulnerable to having ADHD. Also, when I say that ADHD may run in families, in African or in black families, that may be seen as the family maybe is bewitched. People might think that maybe the family is bewitched because the child has ADHD and also maybe the mother or the father also had ADHD. So it's very important that we know about these mental illnesses so that we may be able to educate people about ADHD being running in families so that people are able to seek appropriate assistance, professional assistance. Okay, can we move on to the next slide, which is about development and cause of ADHD. Okay, when a child is a toddler, excessive motor activity or hyperactivity is easily observed or may be observed, but it's very difficult to distinguish whether it is ADHD or not. So that is why we do not diagnose toddlers or young children as having ADHD. We wait until the child is a bit older, but especially when the child starts school, that is where we see inattention and hyperactivity becoming more prominent. And that is when the child needs to be able to sit still so that he can be able to focus on the lesson. So most of the time, the child will be diagnosed as having ADHD when he or she has started school. And teachers in primary schools are the first ones to notice inattention and hyperactivity. But most of the teachers might not know that it is ADHD. They just see that the child is being inattentive and the child is hyperactive, but they may not know that it is ADHD. That is why it's very important that teachers are also able to refer the children to psychologists and psychiatrists and pediatricians. But as the person grows into adolescence and adulthood, some people experience fewer ADHD symptoms, but difficulties with restlessness, inattention, and fidgetiness, poor planning, and impulsivity persist. So as you grow older, some of the symptoms may not be observed, such as hyperactivity. Because hyperactivity in adolescence and adulthood is less common because it diminishes. So the symptoms might become less for some people, but for some people also, they continue to have major symptoms that interfere with their daily functioning. And some individuals may mask these symptoms in fear of being judged or socially excluded. So as you grow older, the symptoms might become fewer, or in some people it may become worse, and it is still going to interfere with your daily functioning. But there are some people also who are able to mask the symptoms of inattention and hyperactivity, impulsivity, because they fear being judged, and they also fear being socially excluded, not having friends because they're impulsive. Okay. Some people are not aware that they have ADHD as they have not yet been diagnosed. They only know that they have some challenges with performing some tasks. So like the person who was in the video, he did not know that he had ADHD. It was only later, when he was about 26 years of age, that he was diagnosed as having ADHD. but he knew that he had some challenges with performing some tasks. So sometimes also ADHD is not recognized or diagnosed until the person is an adult, like I've said. In this case, childhood history is very important as it shed light on the symptoms for ADHD that we experience in childhood. Thank you. Can we move on to the next slide? The next slide is about the ADHD and the brain. So what happens in the brain? What is causing this ADHD? We know that the brain is fundamental in all the functions that the body is able to execute. So what happens in the brain when the person has ADHD? Some of us might be asking. So the first thing that we are going to look at is the brain structure. Research indicates that some structures in the brain in children with ADHD can be smaller than those areas of the brain in children without ADHD. So research has been conducted and the structure of the brain is different for people with ADHD and for people without ADHD. Then another thing that we need to look at is the frontal lobe. So we know that the brain has different lobes. It has 4 lobes, and the frontal lobe is the one that has been seen as impacting on ADHD. So the frontal lobe is the area that's behind the forehead. So it's at the front of your head. That's the area which matures later in people with ADHD. And this area, or the frontal lobe, it regulates executive functioning. So things like problem solving, judgment, impulse control, attention, time perception, social behavior, memory, motivation, and planning, those are performed in the frontal lobe. In other words, the frontal lobe is responsible for these executive functioning that I've mentioned. Okay, another factor that has been looked at as causing ADHD is that of neurotransmitters. Neurotransmitters are chemicals that we find in the brain. They assist with the transmission of signals from one nerve cell to the next. Research indicates that low levels of dopamine and norepinephrine play a role in ADHD. So in children or in people with ADHD, it has been found that they have low levels of dopamine and norepinephrine, which are neurotransmitters or neurochemicals in the brain. That is why they may be having ADHD. And dopamine is linked to motivation. So if you have low levels of dopamine, definitely you're also going to have low levels of motivation, which can explain why people with ADHD have low levels of motivation in completing some tasks. People may be wondering, am I the only one, or how many people also have ADHD, like myself, or like my niece, or like my child, or like my nephew, and so forth. So the estimate of adults with ADHD globally is around 366 million. So that's a large number of people who are having ADHD internationally. According to percentage, it's 2.58% of people, of adults with ADHD. So we can see that ADHD is found globally, and a large number of people have been diagnosed or do have ADHD. And ADHD is more frequently diagnosed in males. Maybe this is because boys are usually more hyperactive. That is why ADHD is more frequent in males, or frequently diagnosed in males, because inattention is very hard to see. And we see inattention mainly in girls, but in boys, there's usually hyperactivity. In adults, the ratio of males to females with ADHD is 1.6:1. So that is why we're saying that there are more males that have been diagnosed as having ADHD. So the ratio is 1.6:1, and that is according to the manual DSM-5. There are also cultural variations in attitudes and interpretations of children's behaviors. So a child may be seen as hyperactive in one culture, but in another culture, the same child may not be seen as hyperactive. It also depends on our attitudes as well as interpretations. Okay, research is also showing that children from poor backgrounds or socio-economic backgrounds, they are less likely to be diagnosed as having ADHD. Maybe this is due to limited access to healthcare, and maybe it's also because some people are not aware of ADHD. That is why maybe in poor socio-economic backgrounds, there are less children who have been diagnosed as having ADHD. A recent study was done in Cape Town in a township school, and it found that less children were diagnosed as teachers had limited knowledge of ADHD. So also the knowledge makes diagnosis sometimes difficult. So if you don't have knowledge, you may not know that the child is ADHD and needs professional assistance. So it's very important for teachers to know about these disorders because they work with children, and especially primary school teachers, because that is when the child may show symptoms of inattention, hyperactivity, and impulsivity. So if the teacher knows the symptoms and knows about ADHD, the child might be diagnosed earlier, and intervention might be received earlier. So the next slide is about comorbidity. So I did say when I started this presentation that ADHD also occurs with other mental disorders. It may occur with other mental disorders. So a person might have ADHD plus another mental disorder. But it's also possible that the person might have ADHD only. But sometimes the person has ADHD as well as another mental health disorder. Okay, one of the disorders might be oppositional defiant disorder. So that is when the child is defiant, especially towards authority. So that is known as oppositional defiant disorder. And the person in the video did mention that sometimes he was defiant. But a defiant disorder is only diagnosed when it is persistent, like ADHD. I was mentioning the word often and persistent a number of times. And also conduct disorder may be comorbid with ADHD. So that is when there is repetitive and persistent patterns of behavior. And these may include truancy, lying, theft, aggression, and so on. So that is known as conduct disorder. You must remember that people with ADHD, they find it very difficult to constrain their behavior or to inhibit their behaviors. So sometimes they end up having this conduct disorder because they are unable to inhibit their misbehaviors. Some people might have also disruptive mood dysregulation disorder, and this may be seen when the person has frequent anger outbursts, is irritable most of the time, and it becomes angry. And when you look at the situation for which he's angry, you see that it is disproportionate of the outburst. And also, people with ADHD may also have specific learning disorder. And specific learning disorder refers to the persistent impairment in reading, for instance, which is known as dyslexia, The child might have difficulty with spelling or written expression, and the child might have difficulty with maths. Remember that in order to learn, you need to be attentive. But when you have ADHD and you have inattentive symptoms, then it means that you are going to miss out on what is taught in class. So sometimes a child with ADHD may also present with specific learning disorder, and this may be seen when the child has difficulty with reading, with spelling, with maths, for instance. So when you are in the classroom, you need to concentrate, but unfortunately for a child with ADHD, particularly the child with inattentive symptoms and hyperactivity, then he's likely to miss out on some of the things, on some of the material that is taught in class, and he may end up having the specific learning disorder. Okay, sometimes ADHD is comorbid with anxiety disorder or disorders. That is when you have excessive worry, for instance, or fear, and the anxiety may sometimes be generalized, or sometimes you might have social anxiety because you are fearing what people are going to say, how they are judging you, and so forth. So you might have anxiety disorders also. Then a person with ADHD may also have substance use disorders, and this is more frequent in adults. They may become drug addicts, alcoholics, and so forth, just because of impulsivity, or they are trying to mask, or they are trying not to think about the challenges that they are having in completing daily tasks. So they use substances in order not to think too much about it, and it ends up being an addiction. Then there is also obsessive compulsive disorder. This is when unreasonable thoughts and fears, obsessions that lead to compulsive behaviors. So we did say, for instance, that sometimes we are forgetful. So a person with obsessive compulsive disorder might, for instance, check the door a number of times when he's leaving to check whether the door is locked. Or the person might be excessively clean because he knows that he is disorganized. In order to combat this disorganization, the person might be excessively clean, and he might be ending up with obsessive compulsive disorder. Then lastly, ADHD may also be comorbid with autism spectrum disorder. And autism spectrum disorder, which is abbreviated as ASD, is a neurodevelopmental disorder that is characterized by deficits in social communication, restricted patterns of behavior, hypersensitive to stimuli, and obsessive interest. So it's very common that a child with ASD also has ADHD. Thank you. Can you move on to the next slide, please? The next slide is about functional consequences of ADHD. We did see some of the functional consequences of ADHD in the video, but I just want to highlight some of these functional consequences. The first one is reduced occupational performance. So when you are working, if you have ADHD, because of inattention or impulsivity, you might be viewed as irresponsible at work. Sometimes you might be viewed as lazy. So it is going to affect your occupational performance. And your academic attainment also is going to be affected if you're a student because of limited attention, forgetfulness, disorganization, impulsiveness, and procrastination. So your academic attainment is going to be impacted negatively. Because people with ADHD sometimes intrude on other people. They don't understand social rules. So they may find that they are socially rejected, and they may also be elevated interpersonal conflict. So in relationships, for example, which I'm still going to talk about, the person is unable to keep time, for instance, is usually late, is disorganized, is inattentive, that is going to lead to interpersonal conflict, and it's also going to affect your personal and family relationships. Research is also pointing out that traffic accidents and violations are more frequent in drivers with ADHD. We do know that driving requires sustained mental effort. You need to be alert all the time. And if you are easily distracted and if you zone out, then you are likely to cause accidents. So that is why the traffic accidents are more frequent in drivers with ADHD. Also, inadequate safe application to tasks that require sustained effort may be interpreted as laziness and irresponsibility. So I've talked about that sometimes you don't apply yourself fully to tasks that require sustained effort, mental effort, and that may be seen as laziness or irresponsibility. And also lastly, ADHD is associated with an increased risk of suicide attempts, particularly when comorbid with mood, conduct, or substance abuse disorders. So people with ADHD have an increased risk of attempting suicide. Because remember in the video, the person was saying he thought he was different and he had difficulty managing himself, managing relationships and jobs. And if you couple that with substance abuse, for instance, then that may increase your risk of a suicide attempt. Treatment for ADHD, we've talked about the symptoms, we've talked about what is causing ADHD in the brain. We've talked about the risk factors. We've also talked about functional impairment. But now we are going to look at treatment for ADHD because there has to be a treatment for ADHD for people to be able to function or cope with ADHD. So ADHD can be treated by use of stimulants and non-stimulants as well as cognitive behavior therapy. So it was mentioned in the video that the person did go for cognitive behavior therapy, but there are also stimulants and there are also non-stimulants. Stimulants, they work on the availability of brain chemicals. So I did talk about dopamine and norepinephrine. So these stimulants, because the dopamine and norepinephrine is low, so these stimulants, they increase the availability of these neurochemicals. I'm sure some of us have heard about Ritalin and Concerta, but Ritalin is more famous than Concerta. So people who are using Ritalin to control ADHD, and Ritalin is a stimulant. So it assists with the availability of the brain neurochemicals. Okay, I just need to note also to state that some people use the medication for people with ADHD, and the people who don't have ADHD, they abuse these medications. I just want to reiterate this warning that please note that ADHD, if you don't have ADHD, then this may cause a decline in cognitive ability. So I just need to mention that sometimes people, they use Ritalin for other things that are not for ADHD, those people who don't have ADHD. So I need to warn them that using Ritalin when you don't have ADHD may cause a decline in your cognitive ability. And also, there are non-stimulants that are used in order to control ADHD, and these increase norepinephrine. And these, according to research, work slightly less well. Then there is also cognitive behavior therapy. And this is when you work with the therapist in order to understand your thoughts, your feelings, as well as your actions and how these interact. And in the therapy session, you are taught how to use your skills or how to use skills in order to meet important goals. So there are skills that you are taught during cognitive behavior therapy so that you are able to cope and you are able to meet the important goals. And cognitive behavior therapy may also lead the client to becoming more self-aware and mindful of your thoughts, your actions, as well as your feelings, and how you may regulate these. So cognitive behavior therapy is very important, as well as medication. So, and some research is pointing out that you need to have medication because medication works on the neurochemicals that are deficient in the brain. So cognitive behavior therapy cannot work on their own. They need to be assisted with medication. But I'm aware that some medication also have side effects. So you need to constantly go to the medical practitioner that prescribed the medication and inform him of the side effects that you are experiencing so that maybe the dosage might be lowered and maybe the medical practitioner might also change you to another medication. But I do advise that people don't just stop the medication because it's causing side effects. You need to go back to the medical practitioner and let him know of the side effects that you are having because he is going to assist you with that. There is some assistance with that. Now let's go on to the coping strategies for students with ADHD. I know that most of us who are attending this session are students, and some of the students or some of the people who might be attending might be having ADHD, or they might think that they have ADHD, or they know someone who has ADHD and is a student. So these are some of the strategies that I'm going to share with you. Okay, according to Wright in 2005, successful students usually have 4 qualities that help them achieve their goals. And these qualities, firstly, are perseverance. Secondly, the ability to delay gratification and to focus on the big picture. Thirdly, time management and organizational skills. And also, you need to strike the right balance between fun and work. So we know that being a student is a lot of work, and you need to persevere most of the time. So if you're not unable to persevere, then it means that you are not going to be able to achieve your goals. And sometimes you need to delay gratification and you focus on your end goal in mind. What do you want to be in the future, for instance? So sometimes we have to have the ability to delay gratification. And also as a student, you need to have good time management skills as well as organizational skills. And we know that for people with ADHD, or for some people with ADHD, they struggle with procrastination. And this may cause the person not be able to reach their goals. And also, lastly, as Wright is mentioning, that you need to strike the right balance between fun and work. So you need to have some time for fun, and you also need to have some time for work. But it becomes very problematic if you are impulsive. So striking the right balance between fun and work might be problematic for people with ADHD. So that is why I said at the bottom that students with ADHD may struggle with the above. But the following tips that I mentioned in the next slide may assist. So here are some of the tips that can help you to cope if you have ADHD, or if you are a student, even if you don't have ADHD. But some of the tips do apply also, to students in general and to those who have ADHD in particular. So the first one is you need to take steps to start your routine, your day on time. So make sure that you start your day on time. Don't sleep until it's very late, because then you won't be able to start your day on time. I do know that some people with ADHD, especially those who are restless and hyperactive, may have difficulty with sleep. So you need to ensure that you sleep on time, even though you do have some difficulty. And maybe you can even share that with the medical practitioner, and he's going to assist you so that you are able to get enough sleep. And also you need to, if you start your day on time, this is going to help you to get organized. And what you can also do, maybe the day before, in the evening, you write down a schedule for yourself for the following day. So you need to have a schedule for yourself on what you are going to be doing the following day, so that you are more organized. And also, I did say that people with ADHD, they do have time management skills. Most of the time, they procrastinate. So you need to work with your age to procrastinate. You may use a daily planner, for example, a calendar, and you record your activities and appointments for the week, for the month, for the day on the calendar. So calendars are very useful, and even the apps, the Google apps that you may use as a calendar, they are useful so that you are able to schedule the activities as well as the appointments, because sometimes you're going to forget. I did say that one of the symptoms is being forgetful. Okay, also regarding study methods, you need to use effective study methods so that you are able to study smarter and not harder. So one of the things that you may use are memory strategies. So you may use mnemonics in order to remember information. You might also have a study buddy, so someone that you are going to study with is going to motivate you, is going to encourage you, because we know that motivation is also another struggle for people with ADHD. When you are studying, you may use highlighters so that you are able to highlight important information so that you don't forget it. And it's also very important that you take study breaks. We did say that the people with ADHD sometimes have trouble sustaining their attention. So it's very important that you take study breaks. You don't study for 2 hours, for instance, but you break it up and have breaks in between. Then also what you can use is you schedule your study time, and you also schedule the time for fun, and you strike a balance between the two. So you need to be a little bit disciplined. When it's time for fun, you have time for fun, but then you are able to go back when it is time for study. Then implement strategies to stick to your plan by making use of rewards. So you may use rewards, external rewards, so that you are able to stick to your plan. And then also you can use electronic notifications as well as reminders. Remember that I did say in the presentation that people with ADHD may lack internal motivation. So the rewards, they serve as external motivation. So if you have rewards, for instance, that can also help you or assist you with studying, because you know that you are going to give yourself a reward. Then also you need to make big tasks more manageable. So if there's a big task that you need to do, please break it into chunks so that it is more manageable. So if, for instance, you need to write an essay that is about 10 pages in length, break it up and maybe write 1 page at a time, but give yourself enough time so that you are able to submit the assignment on time. Number 7, you need to minimize distractions and complete existing projects before you start new ones. People with ADHD are known, they jump from one project to another because they get bored easily or they are easily distracted, and they are always seeking novelty. So it's very important that you discipline yourself or you try, by all means. I know that that is going to be needing a lot of effort from you, but you need to make sure that you are able to complete the projects that are existing before you start the new ones. Then also you need to manage your medication. So this is very important also because, like I said before, if you have ADHD, then medication does help assist with coping and managing ADHD. So you need to manage your medication as well. So when it is finished or it's about to finish, you need to go back to the practitioner and he's going to give you a prescription for you to get medication. So you need to make sure that you always have medication. But if it is giving you side effects, then you go back to the medical practitioner and explain to him that you are having some side effects that are impacting negatively on your studies. Then they will know what to do. Number 9, you need to find out about accommodations in Unisa or the workplace if you are working. I know some institutions, and I know of Unisa as well, they do have accommodations. For instance, they may give you extra time if you have ADHD, but you need to communicate that. I think when you are applying for enrollment in Unisa, for studying in Unisa, that you have ADHD, and I'm sure they do need proof from a medical practitioner that you have ADHD. And they may give you extra time during exams because they do know that sometimes you need to, sometimes you are distracted and you may need extra time in order to complete the paper that you are writing. In schools also, they do have accommodations for learners with ADHD. They may be given extra time when they're writing exams, and they're also given short breaks during exams. And even when they write exams, they are seated where there are going to be minimal distractions. Or the teacher sometimes taps you on the back so that in case you are daydreaming, you are able to collect your thoughts and go back to the exam paper that you are writing. So it's very important that you find out what accommodations are available in Unisa. But also, I would like to urge you also to find out about the resources that are offered by the CCD unit or the DCCD unit. For example, I know that in their website, they do have some study tips. They do have articles or presentations on how to deal with procrastination, for instance. And I also do know that they have other resources like how to develop as a person. For instance, there is a growth mindset presentation in the resources that Unisa has in the DCCD website. So you need to be familiar with that website. It's going to assist you a lot. Then in conclusion, and to summarize, I'm sure now we know that ADHD is not a problem of willpower or laziness, but it is a neurodevelopmental disorder. So it's a disorder that develops during the developmental stage. And also, people with ADHD, they often have difficulty paying attention to tasks, particularly tasks that they find they are not interested in, but they may focus in tasks that they are very much interested in. But most of the time, they have difficulty paying attention to tasks. Also, we did say in the presentation that people with ADHD may have trouble staying with the tasks. So some people refer to them as sprinters, but they are not long distance runners. So they're able to focus on tasks that maybe they are going to take a short duration of time, but they are not able to focus on tasks that is going to require that they maintain their mental effort. So that is why they are referred to as sprinters and not long distance runners. And some people also with ADHD cannot get started until it's an emergency. So that is why I was referring to procrastination. So they may procrastinate until it's very late, and then they get some motivation to complete the task because they see that as an emergency. But some people also don't see it as emergency, so they might end up not completing the task. Number 4, ADHD presents as difficulty with organization or containing their thoughts and actions, and they may be fidgety and restless. So people with ADHD may be fidgety and restless. Some people, especially the young children, they also may be hyperactive and impulsive. So the next one is impulsive. They may want immediate rewards or gratification. So that is what was said also in the video, that the person who was in the video was saying to us that he is an impulsive buyer. So he's also not able to manage his money. And that may also lead you to having the substance abuse disorder if you are impulsive and unable to act before you think. So when you act without thinking, then it means that you are impulsive. You engage in actions that are going to be detrimental to you or negative. They are going to have a negative effect on your functioning. Then number 6, these may impact negatively on their daily functioning at work, in relationships, at school, or at university. So we did say that ADHD may impact negatively on your functioning. Doesn't matter where you are, it may impact your functioning at work, like the person in the video was saying, when you have anger outbursts, when you are not able to be on time, when you make careless mistakes, for instance, and it may also affect your relationships, and it may affect your attainment in school and university. And lastly, I'm sure you have seen when I discussed the issue of treatment that ADHD can be effectively treated and managed. So help is available. So if you need help, what you can also do is you can go to Unisa Counselling unit. You may see a psychologist and counselors there, and they'll be able to assist you. They'll be able to give you support, and they may also point you in the right direction. So help is definitely available, and you are not alone. The counselors and the psychologists are there to support you. Thank you. So maybe you can use this time now for questions, if there are questions.
We had quite a few engagements here, Bongi. Some questions, some were answered along the way.
Okay.
I'll just see. I'm going to start just with this question. How do we snap out of a hyper-focused state when it doesn't concern our university work? I find myself hyper-focusing on things that are not relevant to anything that I'm supposed to be doing for my essays and assignments.
Thank you so much for the question. So you raised an important issue about hyperfocus, and that is when a person with ADHD focuses obsessively on a topic or an interest. For example, some of them may focus on, for instance, hyperfocus on social media. So he may scroll for a very long time, scrolling and scrolling and scrolling, because maybe that is what he's interested in, or they're discussing a topic that he's interested in. Some people may be engaging in video games, for instance, and you find that they play the video games maybe from very late at night until the next morning. So the question is asking, how do I snap out of hyper-focusing? Okay. I did share some of the strategies that you can use, but I'm not too sure whether those are going to answer you. I did say that you need to have a schedule where you list all the activities that you are going to be doing on that day. And you also need to have reminders so that when you are hyper-focusing or you are doing something that you should not be doing and you should be focusing on your studies, for instance, that can remind you that no, you need to stop what you're doing. You need to now begin with your assignment, for instance. So having a schedule or a planner can assist. But also, I did say that you may also consider having a study buddy, particularly as you're working in Unisa. Sometimes you might feel very alone when you are studying with Unisa. So it helps if there is a study buddy, someone that you are going to be studying with, and you are going to schedule time when you are going to meet and when you are going to be doing assignments, when you are going to start with preparing of your exams and so forth. So these are some of the tips that I can think of for now. But I did also say that maybe you can also look forward to a reward that you are going to promise yourself. I said that it needs to be an external reward because many people with ADHD don't have internal motivation. So a reward can also serve as an external reward for someone who is hyper-focusing. So think of a reward that you are going to give yourself when you have completed doing the task that you were supposed to do, and that can motivate you to begin with the task and not to hyper-focus. So that's what I'm thinking of, but other colleagues can also add if there are any other strategies that the person can use in order to stop hyper-focusing.
No, thank you, Ms. Thusi. That answered the question. Julian asks, how do you teach someone with ADHD how to take breaks and maybe come back after they're done? So taking breaks, and also in terms of how do we overcome the executive dysfunction in order to be successful? So how do we overcome that, or how do you teach someone to take breaks?
I'm not too sure whether the person who is asking maybe is a teacher, is asking how do you teach a learner to take breaks? Or I'm not too sure whether I understood the question correctly. But the person was asking how do you teach someone to take breaks?
And come back after they're done.
Julian, come back after they're done.
Yes.
Because sometimes it's very difficult after you've taken a break, then you don't come back and do what you are supposed to do after the break. Yeah, I do get the question. Okay, yeah, so that also is referring to motivation. After taking a break, you need to ensure that you are able to come back. So the question is, what strategies can you use so that you do come back and finish the task that you had started? Yes, okay.
That makes sense.
Yes.
I think someone says, I get bored and discouraged easily, for instance, when I seem not to understand the content and give up without thinking thoroughly. And I think you answered this in part with mentioning the diagnostic criteria. There seems to be a lot of agreement in that regard. With people focusing and someone thanked you for sharing the accommodations for students with ADHD. Some of the other questions you answered as you went along in the chat. Tips for overcoming the physical and mental fatigue associated with inattentive ADHD. There was a lot of support for that question. Do you have any comments on that, Bongi? Like, how do you overcome the physical and mental fatigue associated with inattentive ADHD?
Okay, thank you so much for the question. Yes, it's very true that having ADHD it is draining. It is draining because I did mention that sometimes you have to mask some of the symptoms that you're having. You have to mask when you are in society so that people don't judge you and you are not excluded. So it can be draining emotionally and mentally for a person who has ADHD, and that may also lead to burnout and stress also. So maybe some of the tips might be, maybe you need to find or get a person that you are able to talk to and explain, who is going to be able to understand the condition that you have, the condition of ADHD. Maybe your family can be able to support you, and they can also be able to understand what ADHD is about. That is why, for instance, when a child is brought in for assessment, that we also involve the parents with psychoeducation. So we do educate the parents about the condition, and we also do explain to them how they can support the child and how they can offer some scaffolding so that the child is able to cope. So I think it's very important that we have someone who is going to be there for support, and also having a mental health professional or seeking the assistance of a mental health professional, and because it's going to come up with strategies of how you can cope and how you can manage all these physical symptoms that you might be having. So I think that may assist, but also you need to give yourself some rest, and you need to give yourself some time for fun, but at the same time make sure that you are able to come back to the tasks that you need to do. Before maybe we do the vote of thanks, can I just say my thank you to the students and the staff and the student mentors for attending this this session. And also I would like to thank the CCD unit for affording me the opportunity to be part of this mental health awareness advocacy campaign. And thank you so much, Candice, for presenting all the slides. You've done wonderful work. And I wish all the students all the best for the future and the exams. And I would like us all to urge that we prioritize our mental health. Thank you so much. Stay placed.
Thank you. Thank you so much, Bongi, for sharing your expertise and knowledge about adult ADHD with us. It's certainly raising awareness was important about this, and most certainly led us to better understanding and as a result, support. So thank you for sharing the diagnostic criteria, information about ADHD, the brain, prevalence, the comorbidity, the consequences, and especially treatment and coping strategies for managing the symptoms effectively. There was such engagement, and I think students really enjoyed what you had to share. Thank you for answering the questions and allowing for that as well. Thank you to all attendees as well for your participation and engagement and support and encouragement for one another. In conclusion, I want to invite you all to please join us for tomorrow's session on bipolar mood disorder and depression that will be done by Dr. Sharifa Hendricks, a clinical psychologist and the head of counseling and career development in the KZN region. Also a session on suicide awareness and prevention by Ms. Bianca Friesler, a registered counselor and intern clinical psychologist. That takes place tomorrow at 12, from 12 to 2. And lastly, kindly please complete our evaluation form. We would really appreciate your feedback. Give us some highlights from today and what you'd like to hear more of. But please join us tomorrow at 12. We'll post the link to tomorrow's link in the chat. Thank you, Program Director, as well. And thank you to all staff who are also in attendance today, including our Deputy Regional Director, Mr. Dubazani.
Thank you, colleagues and students. We come to the end of the program. Thank you very much. You are such a wonderful audience. I'm looking forward to see you again tomorrow. Enjoy the rest of your evening.